Good evening, everybody, and welcome to this webinar. Thank you for joining us. My name is Safren. I'm from the Department of Psychology here at the University of Miami, and I'm joined by Deborah Weiss from the Department of Psychiatry and Lunthita Dutherly from the Department of OB/GYN. And we are going to be hopefully helping you find the middle ground, which we will be talking about managing stress and anxiety while providing clinical care during the COVID-19 crisis. The way that we're going to set this up tonight is a little different. First, there'll be a presentation where I will be talking and you will see these slides, and I'll talk about why it's important that we build resilience during this time and how to basically begin to do that. And during this, please use the Q&A feature, not the chat feature, but the Q&A feature that you should see at the bottom of your screen, because during this, Dr. Deborah Weiss is going to be looking at the questions and thinking about what are the most frequent things that people are asking and wanting us to talk about more. And then the two of us will have an active conversation, kind of like a radio talk show. There's one from Boston called Car Talk that maybe people have heard about, but the two of us will kind of talk back and forth about the things that the listeners are asking about and making comments about. And then at the end, we will do a practice guided meditation led by Lunthita Dutherly, and she has a lot of experience with that, and meditation is one of the things that we'll be talking about tonight. Also, before we begin, I just wanted to say a couple of thank yous to some of my colleagues across the country who are doing these kinds of things at their institutions, and we've been sharing back and forth materials because this really is an important time. Dr. Deborah Kaysen, who's an expert in traumatic stress and is the president of the Traumatic Stress Association, International Traumatic Stress Society, and some other colleagues, Michelle Jacobo, Luana Marquez at Harvard, team at Columbia, and others. And also a thank you to Paco Castellon, who coordinated this for us. So the first thing is, why do we want to build resilience now? And if you look at the top of the screen here, we see a graph of where we can be in a traumatic stress pandemic response. And we see right here, there's a pre-trauma stress, which we may be in right now, going into an area where there might be more peak trauma coming up in terms of what healthcare providers will be facing. Some of you may already have been facing it. We have had a few deaths at the institution from our healthcare workers, and we don't know for sure what kind of surges in terms of patients coming in and what it's going to be looking like. Eventually, we'll get through this, and there'll be a post-trauma stress period. Also, when we look at the burden of disease, we are going through in the red line. I'm not sure if everyone can see my pointer, so I'll just state now. The red line is the kind of first wave that can go up, go down over time, and then maybe have a second wave that hopefully won't be as high. But following that, we see the blue line, which will be once we have a decrease in the immediate mortality and morbidity from COVID, we have to think about the influx of all the non-COVID conditions that were not necessarily urgent, but now are become urgent and have been neglected during the crisis, and a series of chronic disease exacerbations. And also the thing that we're here to talk about today, which is the fourth wave, kind of the mental health impact, looking at in the green line, depression, post-traumatic stress, and provider burnout and economic injury. So some of the things that we're going to talk about today are hopefully to try to mitigate this fourth wave of depression, post-traumatic stress, and provider burnout. Another thing to keep in mind is that anxiety is a natural reaction to unpredictable, uncontrollable stress, and it's a very natural reaction to a threatening situation, which this is. And in acute form, what you see on the left side is that when stress occurs, you have what's called the fight or flight response, where your body really mobilizes to either attack your attacker, the fight response, or flight, run away as fast as you can. And there's lots of parts of your body that reacts, as you know, like the saliva, you see saliva flow decreasing, your blood vessels constrict, your heart beats faster, your pupils dilate. All the energy in your body, like adrenaline rush, goes to this fight or flight response. And that can be extremely helpful if you're being attacked. However, we don't want that to continue. And we are in a situation here with COVID-19 that the stress is continuing. And we need to try to mitigate that and slow down this reaction to prevent the conversion of acute stress to chronic stress. With that, the other thing to think about is this ideal level of pressure that exists, where, looking at the graph between performance and pressure, that when you have no pressure, you're bored. Maybe there's an ideal performance zone where you have some pressure and you have comfort or stretch, but then it gets to the point of strain and eventually burnout. And again, in this time where we are experiencing stress, we want to try to help providers, help you not get to the strain and burnout part of this. Another component of stress is when we think about how the brain operates under typical and atypical conditions. So typically, hopefully, what happens is under typical conditions, our brain observes things, we have input, we interpret it, whether it's a threat or not a threat, we process it, we evaluate our options, we plan, and we act. However, with repeated stress, what can happen is that the alarm system is sounding and we go the express route as the main route. And so in the face of danger, instead of processing and evaluating and planning, we take that fight or flight freeze response and do the express route. And that, again, might be good in an acute situation, but with a situation like this where things are prolonged, we have to be able to, in order to preserve our mental health and also make the best decisions in providing care, keep this logical mind, wise mind, processing and optimal problem solving. So the title of the talk was Find the Middle, and finding the middle, what that really means in order to avoid transitioning from acute stress to chronic unhealthy stress, is looking at that middle ground between what you're experiencing as valid feelings of fear and anxiety during this very challenging time and adaptive and effective coping to build resilience. How do we do that? Well, there are 3 ways that are pretty universally accepted in terms of trying to mitigate this sustained fight or flight reaction. The first thing in this type of situation is to make sure that despite the work that you're doing, you have some time to unplug and anchor. And I'll talk about each of these bullet point issues separately in the upcoming slides, but this means making sure you have social support, making sure that you have everyday pleasurable activities, doing things like meditation and relaxation, again, to kind of anchor yourself, and combat excessively negative thinking, even when times are scary. The second is to charge up. So building resilience by eating well, taking care of your sleep, exercising, all these things help your mental health and, of course, in turn, your immune system. And a third thing that can help build resilience is feelings of being of service. And you're already doing that as providers. So take some time to be proud of your accomplishments and your work during this time. And also, as I'll be talking about, use effective problem solving the extent that you can and not continue in that fast fight or flight response system. So back to the ways of mitigating this sustained fight or flight response. The first one was unplugging and anchoring and looking at social support. So for you, think about that there are different types of social support out there. There are, as you see on here, support for your needs, there's emotional support, social connections, social support in terms of feeling needed or having self-worth, having reliable social support. And then there's the practical part, advice, information, physical assistance, and material assistance. As we're gearing up to get into what could be, could be worse, and we could be experiencing soon more cases, more work, more shifts, different types of potentially upsetting and grief situations, gearing up and making sure that you have the type of social support from these boxes that are going to be most useful to you during this time. And every study of stress, almost every study of stress, really highlights this basic but very important component of coping, which is having social support, and social support being a buffer of the negative effects of stress. Another key thing that you can do for your mental health to basically prevent or treat depression or sadness, bad moods, mood issues, is this thing called behavioral activation. And what that means is, it's not really rocket science, but it's events or activities that produce feelings of mastery, meaning that you feel competent, that you feel good about yourself for doing them, or pleasure, and that you have those scheduled in your day every day. So even if you're working for most of the day, to try to have some time where you also are doing activities that are pleasurable. And even when you're cooped up in your house, find creative ways to do these kinds of things. So whether it's listening to music, playing with your kids, baking or cooking, using escape TV, movies, books, or hobbies that you can do in the home, that the more you can make sure that you do these kinds of activities, again, that cause mastery or pleasure, the better your mood will be. And it's important to explicitly schedule these things during the day to, again, build that resilience. We talked a little bit about recharging and unplugging. So recharging, that means relaxation exercises, really learning. If you don't know how to relax, there are many. If you Google progressive muscle relaxation or imagery relaxation, there are ways to train you to really notice and learn what it feels like to feel physically relaxed. Mindfulness, which is not the same thing as relaxation, it's non-judgmental awareness of the present moment, and you will be guided in a mindfulness activity at the end of this. But there's also a lot of different apps out there and websites and things that can help you learn mindfulness, and it is another way of recharging. I'm going to talk about, for a minute, deep breathing. Deep breathing is a way to you don't get a full-fledged relaxation, let's say, but it is something that you can do quickly. And it is taking a breath where you're breathing all the way down to your stomach, and you simply inhale and relax. And you slow down your breathing. Could just take 30 seconds to kind of take 5 deep breaths to slow down your breathing and just take a quick break. And that's something that I would recommend you do even while you're at work, if you're seeing patients, between patients, to, walk into the bathroom, close the door, take a deep breath, 30 seconds, maybe 6 deep breaths, and then go back out and recharge and get yourself back to kind of a non-chronically stressed level of physical relaxation. There's exercise, yoga, use distraction, use humor. I have on here, keep a schedule. And then, if you notice that your distress or impairment is more severe, that it's really affecting you, that it is affecting your ability to do your job, that you are really feeling high levels of distress, to seek mental health help. And even if you're not sure if you need it, the psychiatry department, and we have the resources at the end, is offering 30-minute coaching sessions. They are not diagnostic, they're confidential. They are simply speaking with a mental health professional to coach you through some of this. And they're free and they don't go into your medical record. So you can just sign up for it and talk to someone and see if maybe, maybe they can just coach you through it, or maybe they can provide a referral if you need it. And one big thing is that when we talk about mental health distress, it is a very, people associate that sometimes with feeling weak or guilty, or like it's a weakness, and it's not. There are, some people are more prone to having mental health problems, and it's just like having a physical health problem, and if you need help, you should get treatment. Okay, and then we have unplugging. Limit your consumption of the news. If at some point, please, feel free to listen to the news, but don't get addicted. At some point, it just gets repetitive. It's not helpful anymore. You're not really getting new information. You're just getting riled up. And find when it's good for you to shut it down, maybe a certain amount of hours before bed, and have it be that you're kind of done with it for the day. And I had already mentioned taking frequent breaks when at work. Finally, I have a few slides here on self-talk and beliefs and other finding the middle. Finding the middle between self-talks and beliefs. We have two types of beliefs that can be unhelpful at times. We have common provider beliefs that can sometimes be unhelpful, which are things like, I must be strong at all times. It is my oath and duty to do everything to help. Well, that can be a helpful belief and thought, but also can get a little extreme. I need to be the pillar for my family at all times. I need to save everyone. I need to do more. Within this, we kind of have the provider invincibility beliefs. And then on the other side, kind of polar opposite, but also can be unhelpful, is our thoughts like, I'm overwhelmed, and these are valid things to be thinking, but they just, sometimes if it's excessive, it is difficult and distressing. But I'm terrified every time I go into the hospital. I can't do this anymore. I can't manage everything. I can't take care of others when I'm so upset. And what we want to try to do is come up with skills and strategies to help you find the middle between those things where those thoughts are not too strong. Now, how do you do that? Well, whenever you're faced with a problem, there's really only, you can really only do what you can do. There's the, the serenity prayer to accept the things that I cannot change, and courage to change the things I can, and wisdom to know the difference. It really is in the situation to be taken to heart. So when you go through the problem solving and you slow things down and you ask yourself, what are the possible solutions? What is the best solution of the possible solutions? And how can I break that down into steps? And is there anything else I can do? And you do those things. And after that, that's not going to cure COVID. That's going to help you deal with the things that you can do. And from there, there's still things that are scary out there, and still things that are distressing. And what you do is you turn to what we call more emotion-focused coping, or acceptance and soothing, where you simply try to non-judgmentally notice your emotions, take stock of how you're feeling, tell yourself it's okay to have these feelings, and do some of the self-care strategies that we had in some of the prior and new slides. Another way to think about this is to look at the overlap of reasonable mind, emotion mind, and in the middle we have wise mind. people talk a lot about guilt feelings and managing guilt during these kinds of situations, especially when, no matter what you do, there still are going to be people that don't get better from, unfortunately, COVID. So thinking about how to manage guilt, we talk about slowing down your thinking and going back to those steps that I just said. Once you've done everything that you could have done, that's all you can do. And after that, you have to just kind of try to soothe yourself. And when thinking about guilt, it's really important to look at your intention. Hindsight bias is 20/20, so remembering things like that, and being gentle to yourself, and telling yourself, really, what would you say to a friend about this? This final slide before we turn to the discussion has different resources that are available to you on our CHARM website. It's right up here, https://charm.miami.edu. We will be updating that as more things become available. This doodle poll, it's completely confidential. That you can click on that if you want to schedule one of the coaching sessions with the psychiatry department representative or mental health professional, as I mentioned. And through psychiatry, we, a group of us, including, led by the psychiatry department, but members from other departments across the institution, we are developing some additional resources coming up that might help taking a lot of the skills that we just talked about, but having separate whole groups, specifically, hour-long sessions on each of the skills. And we are thinking that we probably will be offering that separately for faculty, nursing and other health professionals, house staff, and support staff. So that's to be coming, and keep watch of at least the CHARM website. That will be updated with any information. So the psychiatry website will be as well. And then other resources that are listed here. Some child ones, people get really, wanting to know how to work with their children. Some apps that we believe are helpful, and some hotlines. So at this point, I think we are at the time where I will ask Dr. Deborah Weiss if she's been getting questions and what are the most frequent kinds of things that are coming up.
Hi. Well, I have had a few questions, and what I thought I would do is maybe introduce them, and if you have more questions that come up.
Sorry, I'm trying to shut off the sharing of the screen.
Fine.
Oh, okay, stop share. Okay.
Okay. So we have had some questions that have come up, and so I want to share them with you, Steve, and we can talk a little bit about what they are. And I want to just maybe give our listeners a little bit to think about. And I want to ask you to consider three things as we talk about the questions. One is that other people have had these experiences too, so you're not alone. The other one is that other people have gotten through these experiences. We've seen what's been happening in other cities, and we see how people can pull through. And then the last one is what Steve reminded us about, which is that it's normal to feel this way. The things that are coming up for us on a day-to-day basis are normal. So one of the questions that I have gotten is, how did we deal with being afraid to go to work? And when we think about being afraid to go to work on a practical basis, sometimes it can feel pretty scary to go just about anywhere. But people are really coming forward and saying that they feel nervous about going to work. So one of the things that I would encourage us to think about is to recognize, as Steve had pointed out, that this fear that we have is a normal fear. It's normal to feel anxious about the idea of getting infected. It's normal to feel anxious about not knowing what's going to happen. one thing that can help is to remind yourself that other people are feeling this too. Your colleagues, the other people in the community, the people that you're around at the grocery store, other people feel that same fear. You're not alone. We're all in this together. I heard the other day, actually, we've always been in this together. And we're all facing those fears together, and it's really normal. Steve, did you want to add anything related to what we were talking about with the presentation?
Yeah, I mean, just with this fear of going to work, I think that, you know, it's going back to that finding the middle thing, that, you know, you have to try as best as you can to use those acceptance-based strategies for the things that you can't really control, and the problem-solving strategies to minimize your exposure. So if you're afraid of, you know, let's say getting exposed or exposing others in the process because you're getting exposed, you know, it's just basically to try to minimize that to the best that you can, and then move on to the acceptance-based strategy.
Yeah. I want to remind
remind people that if you are watching Zoom, the way to ask a question is down at the bottom of your screen. You should see, you might have to click on more or something like that, but at the bottom of the screen, there should be a Q&A next to the participants, or maybe you don't see the participants thing, but there should be a Q&A feature at the bottom of the screen that you can click on.
Thanks. So another question that's come up is for, I guess, people who are working in the healthcare field. They're saying, how do I deal with the feeling of vulnerability to infection? Meaning, you know, the fact that I have always felt as a healthcare provider that I'm invulnerable, or maybe as a caretaker, I've been invulnerable. I've been taking care of other people, and it's always been them who've had the problem. And now for the first time, it's me that I'm worried about myself. And that can be really, really scary. And I, again, want to say everybody, I think, is struggling with that feeling. How do I deal with that? And it helps you, I think, to think about your patients. So we have many years of experience, most of us, with talking to patients who are scared. And we know, as we have so often said to them, you know, we know what we have said to them. Is it possible for you now to say that to yourself? Kind of like the way we might do with children. You know, what would you say to a child? Well, that might be what you would want to say, you know, to yourself. We have those solutions for our patients. They are solutions that we can use for ourselves, and so we have to say that that's an option. I have a question that's come up just now. And this question says, what happens if your anxiety gets out of control and you really can't manage it? What can you do? Do you want to talk about this, or shall I?
Yeah, I mean, I think that's a really great question. So when we think about anxiety out of control, that can mean many different things. So it can mean just extreme distress that you are having, that maybe you're having, you know, throughout the day that you can't control, like worry, and what to do about that. So there are cognitive behavioral techniques to manage that kind of anxiety. I can mention a few of them here, but if it feels like it's so distressing that it is truly out of control, that is where I would definitely call the coaching line that Psychiatry is offering, and we will, on our website, make sure to have that publicized. But some of the things that you can do for uncontrollable anxiety, those are things like, again, the relaxation strategies. There are ways to try to train yourself to control anxiety. It sounds kind of silly, but as soon as you have an anxious spot, you write it down and you tell yourself, I'm going to worry about this later. And you actually schedule a time where you actually do worry about it later. And it's called basically a worry exposure. And you try to, you know, this is just one of the techniques, but you try to habituate to the worry. So, those are two things that you can try. There's also a technique called cognitive restructuring, which teaches you how to think more adaptively. So, so these are things that you can try. There's some great books out there. One is called like Mastery of Your Anxiety and Panic. There's a book by Marty Anthony, Marty Anthony about this, and I would try those kinds of strategies, and I would also use the psychiatry or the coaching.
Along that line, there's also another question about how to ease a panic attack. What's the fastest or best way, this person asked, when there are no medications at hand? And this is something actually that Steve and I talked about the other day, because this is something that's coming up with a lot of people. And that kind of panic, can really be defined as a panicky feeling or a panic attack, which are really two different sorts of things. Panic attack, we want to say, is really about a different kind of level of anxiety.
Yeah, thank you. So I started off saying there's different kinds, and then I didn't get to any of the different kinds. So thank you for reeling me back on that. But there's a panic attack, which is a sudden extreme rush of anxiety that can almost feel like a heart attack, where, you have all of those symptoms like rapid heartbeat, you're out of breath, you might feel faint, you might feel dizzy, all kinds of symptoms like that people will sometimes confuse as a heart attack. And, first of all, you have to make sure that you're not having a heart attack. And if you're not, you just really have to kind of sit with that feeling, and eventually it does go down. And once it does, that's when you try to kick in some of these strategies. But when you're having an acute, panic attack, that's not really the time to, try to make extreme decisions about things. It's more to try to like sit yourself down, ground yourself, and just kind of wait for it to go down.
Sometimes people will say, if they're able to get out of the setting for a few minutes, this may not be available to you, but to be able to go outside and take some air in, or to do some of the deep breathing Steve talked about, that can also be very helpful. I want to just mention again that that kind of panic feeling, not a panic attack, but agitation and panicky feeling, can make us irritable, and can start to make us feel irritable with each other, with other people, with partners, and so on. And we do have a question that says, how do I deal with the anger and irritability that I'm feeling constantly, and is hampering my relationship with my spouse? Well, that's something that I am hearing over and over and over again from people who are finding that, they are going home with a lot of frustration, a lot of irritability. Really, we're spending a lot of time in a high stress situation on top of family members or partners at close quarters. If we're in a relationship where we live with our families, these are really stressful circumstances. And when that stress builds up, we can snap at people, kind of like those old stories about going home and kicking the dog when you're in a bad mood. And I think it's really probably coming from that feeling of being helpless and not really knowing what to do. That's normal, right? That's the first thing we need to recognize, is that feeling helpless, feeling frustrated, feeling angry, that's a normal feeling. It really helps to share that feeling with the person that you're angry with, right? It really helps to say, this isn't about you, although it may sound like it's about you. This is really about how I'm feeling right now. The other thing is to realize that other people are also feeling everything that you're feeling, right? You're feeling closed in, you're feeling like you don't know what to do, and that's exactly what they're feeling as well. And it's good to talk about that. I was listening to something the other day, and someone said that irritability is like a mosquito that's, flying around your face. Sometimes you can just shoo it away and get some space from it. So some of the things that Steve talked about with, doing other things like yoga or going outside or just doing a timeout can really help you.
Go ahead. I was just going to say, a lot of those strategies that I was talking about and that you were just mentioning, those are good to do. Like if you're feeling like you're constantly angry or irritable, or you're feeling that you're constantly anxious, like the kinds of things that I'm talking about doing are a bit preventative. So like if you're noticing that you're very anxious or worried when you come back from work, like try to do some of this stuff, like listen to nice music and not the news on your way home, and use that as a time to calm down. Maybe when you get home, you tell your spouse or significant other that you need some alone time for the first 15 minutes, and you go into a private space, and that's when you do your meditation, your relaxation, or the positive activity, like if you read a book or watch your favorite Netflix thing for even a half an hour. But all that stuff is to try to keep your baseline down, and all those like graphs and stuff that I'm talking about with chronic stress and acute stress, all these things are to try to keep your baseline down so that you're not going to snap either with anger or with panic or anxiety.
So on that line, there's another question about anxious people in the unit. And I just want to touch on this briefly because there's another question I want us to think about. But it says here, sometimes one anxious staff member can make the whole unit more anxious. And this is a great time to do what Steve's talking here too. When you become aware that that one really anxious person is starting to generate anxiety in the whole unit, that's a time to maybe just take some time out with that person, try to make them aware of what they're doing, and try to redirect them, do that reframing and redirection. I want to just go on to this question because I think it's really important, and this is something I've heard from a lot of people. It says, the fear of the unknown is so overwhelming, it's hard to reassure my children. When there's so much, even the experts on the front line can't explain. It feels really different. So I really want to make this maybe a question we can talk about with regard to children, because this is coming up for a lot of people. Kids are scared. We're scared. It's not a good recipe. I was sharing with Steve the other day, my grandkids were talking to me about their nightmares. And, nightmares are one way to open up what children are really feeling, saying, I had a bad dream. What about you? Have you had a bad dream lately? I mean, it really tells you a lot about what's going on with kids. But Steve, there are some great resources for children that you had put online at the end. And there's another question here. Somebody is saying, how can I get these resources? And we'll put that back up on the screen for you. But do you want to say something about children, Steve?
Sorry, it's a little bit of multitasking here. I was just reading through the questions because I hadn't scrolled.
I could talk about it.
But, I think that the kinds of things for children to think about are, of course, looking at what developmental level they are at and trying to cater the messaging to them at that level. But also, you can't really hide the stuff because they're going to find out about it, whether, through TV or through other kinds of ways. And I think having things like there being a routine, trying to control your anxiety by looking at reputable information, trusted others, the healthy lifestyle behaviors that we talked about, asking them what they know about the situation and trying to reframe it, but validating their concerns, being available for questions, of course, modeling the hygiene, and pointing to past examples of coping with challenging times, and I'd say avoiding blaming others. But as Deborah said, there are some really great resources for working with children. One of our faculty members, Jill Ehrenrock-May, is doing some work, and we have a link to some of that. And then also Massachusetts General Hospital in Boston has the Clay Center for Healthy Minds for Children, and that's one of the links that we have that we will also send out, and I think we'll probably be able to post on our website to go to for more resources for children. And people are also asking about books and things like that, or references, and the links that we have do have a lot of information like that available.
Great. We have a couple of questions that I want to just touch on. One is about cultural differences. How do
Yeah.
we deal with the fact that, culturally, we may see this a different way? I hear all kinds of differences from different people about, that are based on religious views, political views, as well as cultural views. And how do we deal with that? And I would say it's really important to honor and respect someone's point of view, because we do all have our own way of dealing with these kinds of things, and we do have our own way of understanding. Most of my work is international, and I'm dealing with a lot of different cultures. And one thing I have learned is that I cannot impose my own cultural viewpoint on people in another society or another culture, and it's not helpful to them either. Steve, do you have any thoughts about that?
I think you touched on it really well that, if you're talking about caring for people of a different culture, of course, use all of your training and cultural differences and making sure that you're validating their experiences and learning what they believe about it, and validating that. Um, yeah, we don't know what I don't know, our background in charm is with HIV, where stigma was a really big and continues to be a really big issue. And, I don't know if we've seen or if we know yet if there's going to be like a lot of stigma associated with COVID necessarily. But, the sad thing is that already there are I'm seeing on the news things about, um, how it is affecting or going to be affecting lower socioeconomic status places. Maybe one reason because of lack of insurance, and other reasons because of how housing is set up and things like that. So, trying to just continue to be the best that you can in terms of working with patients and being respectful, as you said.
Well, it's actually a good comment, because there's another question that says, what about worrying about so much about our patients? It says, one person says their clients are mostly geriatric and low socioeconomic population, and they're at much higher risk. And that is a very real fear. So I want to say, first of all, that's very valid. As Steve would say, that's a valid fear. And it's true that you as a health professional are probably used to feeling like there's something that you can do. You can fix this, you can respond, and you are perhaps feeling like you don't have that ability that you've had in the past. And you have to honor that. I know that doesn't sound good, but you have to recognize what Steve was saying earlier, that there are some things that you are simply going to do your best, and the best is all you can offer.
Yeah. And then you have to focus on the acceptance-based strategies or the emotional ways of coping instead of the practical, because you can only do what you can do.
Yeah. There's a really good question here that I can totally relate to about older children, and not because I have any older children around, but my grandkids. And it says, what about teens and young adults who are literally back under their parents' watchful eye? What a difficult scenario. What a difficult scenario that is. And I know I have heard from other families that already there's a little bit of discord and irritability. And in a way, you can do some of the things that Steve recommended for younger children, which is bringing them into the active caring in the household. So that they have a role, that they have responsibilities. They're feeling just as helpless as you are. They're also feeling that they don't have to worry about this. This isn't their problem because they're young and they're invincible. And I think it helps them to recognize that there's a responsibility to the whole family, to the larger family. And that's perhaps a way to think about that. I think we have time for maybe one or two more questions. There's a tough question here. How do I tell my employees that they may not have a job much longer? And that's something that everybody is grappling with. Um, I think, the best thing from my own experience, the best thing is to be 100% honest. with the people who are working with you, and to give them 100% acknowledgement that you're doing your best and that you will try to help them so far as they can. I know it's a very painful conversation. I know that you maybe are feeling like it's your fault or you should be able to fix it. I bring you back to Steve's comments on accepting what you can. Steve, you want to say something about that? You and I have been in this experience before.
Yeah. Well, I mean, I think, well, with staff, I just would agree with you, you know, being honest and being upfront about it. And, you know, again, there's really nothing that you can do except for trying your hardest to keep them on. And if you can't, unfortunately, it does get to that point. And I think this is really the common theme throughout a lot of the questions, you know, whether it's managing patients and making really difficult decisions. We don't know what's going to come. There are in some systems, like in New York, you know, things like, and we're talking to providers, so being prepared for things like, you know, not just laying off leave, but also thinking about like, do we have enough ventilators, and can, you know, how do we decide, and do we follow these decision rules for ventilators, and how are those things determined, and how do you tell someone they're not getting a ventilator, you know, and these might become things that happen during the peak of, you know, like I said, if we're not in the acute trauma, we're in the pre-trauma phase, like these things might happen. And I think the only thing, you know, the common theme for all of this is to really honestly do what you can. I mean, you know, the world is really looking to and appreciating so much the work of providers. Like, please continue to do what you can, but don't burn out, because we need you. And the way that you don't burn out is you take care of your mental health, and you make sure that you have the social support, that you take breaks, that you know, that you use these acceptance-based coping strategies to tell yourself, once you've done all you can do, that that's all you can do. And so then it is time to try to distract, to soothe, to bake, to be with friends, to have a virtual happy hour, to have a virtual reunion, to take your mind off it so you can unplug and recharge. And that's all there is, unfortunately. I mean, I wish there were more, but that is all there is. And this is a difficult time, and we are in it together, but this is, you know, these are the strategies that exist.
There's one last question, I think, and that is really, there are two questions together, and I'll put them together for you. One is about how do we deal with the frustration that's occurring due to poor management of COVID in our state? And the other question is, how do we deal with anger about those people who are not compliant with regard to protective measures, you know, wearing a mask, for example, social distancing? I think these questions are kind of similar because they're both about things that we can't really control to an extent. So I'll just give you my 2 cents here. It might be helpful for you to recognize that people who are not following the rules, the measures that we've been asked to follow, social distancing, using a mask, that a lot of times people do things that are not rule following because they are in denial about what's really happening. And their way of not dealing with what's happening is by not following the rules that relate to that. So if I don't wear a mask, then I'm communicating, I don't really think there's a problem. You know, and this issue about, yeah, go ahead, Steve.
I was thinking about when I was a patient that I had when I worked at Mass General who had really struggled with road rage. It reminds me a little bit of this because it is a valid feeling of anger when people are really bad drivers and cut you off or do whatever. But this guy would really, really get angry. Like, he would follow people. He would get out of the car, start screaming at them, you know, like threaten to beat them up. Thank God he never. This is like the sweet guy who I had as a patient, but really was affected by it. And, you know, one of the things that eventually resonated with him was when I, said something like, okay, well, you know, you're not going to systematically get to every single person that cuts people off on the road and teach them a lesson, like, because you wanted to teach them a lesson. That it's not, that's not really realistic. And, we've really talked about what's the best thing to do for you in the situation. And again, I just go back to this thing of acceptance. Like, unfortunately, like, we can go out there and we can try to, do our public health campaigns and, work on ways, if you are upset about how the state is handling things in this question, like, work on ways to the extent possible to change things like that. And then there does have to be a time in the day for you, particularly as providers, to know that you cannot change everything in the world. And that, again, goes back to these acceptance-based strategies that we were talking about, and trying to find the middle and trying to find ways to center yourself and calm down and take breaks and unplug and recharge, because things are just not normal right now. And the only way to stay mentally healthy is to explicitly make sure that you're doing these strategies during the day.
So I'm going to ask, and I'm going to say one more question, answer it, and then transition into Lunthita. So here's the last question, and it really felt this. It said, I feel so impotent. How do I get back the feeling that I am in control of my life, even though some of it has been taken away from me? And the answer is, as Steve is saying, is acceptance. The illusion that we are in control of what's going on around us is only an illusion. We have to accept that we can only control ourselves. And we can make an effort to control the things that are going on around us, but at the end of the day, we can only control ourselves. And that's the serenity prayer, right? The courage to change the things you can, and the wisdom to know the difference. So with that, I want to thank everybody for your questions. I'm sorry everybody's question didn't get answered. Next time. And I'm going to transition to Lunthita. Lunthita is an amazing woman who's going to lead us in a brief meditation. And after that, then we'll, I guess, have the slide up so that people can get more information if they want. And you can also go to the CHARM website for more info. I'm going to go on mute now and pass it off to Lunthita.
Thank you, Deborah. So I have been practicing meditation for many, many years. Actually, this year will be my 30th anniversary, and I've been teaching meditation for about 26 of those years. And I teach at both the wellness centers at both campuses. Now the classes that I'm teaching are virtual via Zoom. And so you can go to either one of the websites if you'd like to tune in to a lunchtime class. They're offered Monday, Wednesday, Friday at 1:30 and Tuesday, Thursdays at 12:30. So I began practicing regularly because I myself, many, many years ago, was experiencing insomnia, and I didn't know what it was, but I found out later on that it was a panic attack. And so the regular practice of meditation first was a way for me to just kind of solve these issues that I had, but then it became a very important part of my life and something that I do every day. And I encourage you to consider practicing on a regular basis, not just now that we're experiencing these very difficult times, but also to practice, even if it's just a few minutes each day, and that can help to avoid the crises in the future and help build the resilience that Steve talked about earlier this evening. Now, some of you may be familiar with different types of meditation. It may be a little different from what you're going to learn today, but basically all roads lead to Rome. So by learning one method, it's really a matter of finding the one that suits you the best. As you saw in the little bio that came up when you registered for the program, the class, is that the type of meditation I teach is based on the heart. Really, we're talking about the spiritual heart. And it's what I learned from my meditation master that I've studied under for 30 years. And it helps us to build individual qualities like inner peace, compassion, love, and hope. So if possible, I'm going to ask you to begin by closing your eyes, or you can remain with your eyes partially closed, partially open, I should say. And let me begin by sharing my screen. Wonderful. So hopefully you're in a place where it's relatively quiet and that you're seated either in a straight back chair, or if you'd like, you could experiment with sitting on the floor. Some of you who have meditated in the past, or perhaps you've taken yoga classes and you're comfortable sitting cross-legged. And what I'd like you to do, everyone, let's go ahead and take a deep breath in, breathe in, and exhale. Take another deep breath in and breathe out. And now begin to slow your breath down so that with each inhalation, you're breathing in calm and relaxation. And with each exhalation, you're releasing from your breath all of the stress and the tension. Breathing in calm and relaxation and breathing out the tension. And let's take about a minute. We'll have some music in the background. So with each inhalation, breathe in peace and calm. And with each exhalation, release from your mind your thoughts. Breathe in peace and calm, and allow your mind to expand like the sky, letting go of your thoughts. Now slowly open your eyes, bringing your awareness back to the room. Look around the room. And now take another deep breath in and exhale. I wanted to leave you with a couple aphoristic or inspirational writings. The first one that you see up on the screen, which is peace opens up the first door to every human home. Peace opens up the first door to every human home. And this next one I added spontaneously during today's talk based on a couple comments and questions that came through. And basically what this tells us is that from each individual person, like a drop of water that ripples out into the ocean, that if we ourselves are experiencing peace and calm, then many, many good things will come back. What we're able to do not only for ourselves, but for our loved ones, the people and the staff that we're working with, perhaps we're supervising. So again, just kind of bringing home the importance of feeling inner peace and calm inside of our own selves. So thank you, everyone. Once again, we wanted to remind you that on the charm.miami.edu website, the list of resources will be posted